why I decided to get a tummy tuck. I actually came here for a breast augmentation, and when Dr. Daluvoy took the pictures, I was like, wow, I look pretty great, but what the heck is going on with my stomach? And so when I had those pictures, I started asking him questions because I had been working so hard. I'm a mom of two, and really just over the years, very regular exercise and nutrition regimen overall. And I just could not get that last 5 pounds down in that tummy area. There wasn't any obvious signs to me that I needed a tummy tuck. I had a hernia and an umbilical hernia that I knew I wanted repaired. But when I saw that picture, it just became really apparent that I needed to lose fat in my mind. And he just looked at me and said, "What fat?" He said, "That's skin. That's not something that you can take care of on your own." And he kind of showed me the anatomy behind it all. And I realized kind of with my husband that was something that I had wanted to change and had worked so hard to achieve. And when he explained the tummy tuck procedure and showed me the pictures, which I was very hesitant to even approach it because of the scar. When I saw his before and afters, I was immediately sold, and we called within an hour to book the appointment. So I didn't end up going with my original intent of the breast augmentation, but I was really excited for that procedure. But I jumped into it pretty quickly with not much thought after seeing the success of his previous patients. Dr. Daluvoy is wonderful. He's actually, I think, one of my favorite people because whenever I leave here, I feel so empowered and excited and good about myself, and lots of compliments come from him, which is nice. Also very professional overall, and just wonderful. Comforted me throughout the pre-surgery time, throughout the surgical period and recovery. And so I really trust him and trust his guidance. He's given me practical things to do with really clear and concise direction. So there's a lot of trust there. And also just, like I said, a lot of respect overall. I've really enjoyed him, and we'll find some other excuse to come in for follow-up appointments later on. So from the process perspective, things have been seamless, and it's about 7 months out now to where I'm almost completely healed from the surgery, and I felt very well taken care of overall. I spent a lot of time evaluating and breaking down processes in my career, and it was an interesting thing to see how seamless that this went and how each step just was so purposeful. I've had great interactions and very easy to take in guidance from the nursing staff and other staff in this clinic. The surgery itself, and when I decided to do the surgery, from when I decided to actually getting the surgery was about, I think, 60 days. So there was a pretty short turnaround. And I had mentioned it was a last minute kind of decision to go and do this, but one that I felt confident in doing. And what was really wonderful about this all was that I felt really confident going into the surgery with the comforting staff, and was really confident in the way that I was being taken care of as a patient. And then post-operative, it was a really rough recovery, and I still felt well taken care of, not only by the staff, but it also brought in a lot from my family as well. I had to be taken care of by my parents who live out of state, and it was just really wonderful to have that support from them, and to from my mom, for example. Like, a mother never stops taking care of her children, and for me, with my 2 kids, my 35th birthday was a couple of weeks after the surgery, and what was really great, the gift that my husband gave me was basically some dollars towards a shopping spree, which was very kind and considerate with this new body. But he also wrote me this letter that really explained how much my body had gone through for our family, his acknowledgement of that. Of course, he was heavily participating in the recovery process with me and just helping me along. My kids were bringing me snacks and food and water, and it was just mommy was being taken care of instead of taking care of everyone else. And they were really acknowledging all of how much I had done, and they really felt that when I wasn't able to get out of bed at the drop of a hat and just take care of everybody else. So that's still carried on now to where people are taking care of mom a bit more, and so that's been really wonderful. It's also been really empowering too, because my husband, with a beautiful note, and then also my dad had talked to me about how empowering it was that I was taking control of my healing instead of waiting and pressuring myself to get there on my own. And I had realized through consultation that I wasn't able to get there, so there was this acceptance that I needed to take in, and then also feel confident in my decision to take control of my body and not wait for it to heal, because it wasn't able to in the way that I wanted to. And that really that really meant a lot, that there was zero judgment from my family all around. Also just sharing, again, how much my body had gone through, and that acknowledgement as a mom of two. And then that turned into, later on, when I was finally cleared to exercise again and get back to my healthy lifestyle, months later, when as soon as I was able to exercise, I was able to, day one, squat completely down to the floor using weights and have complete control of my torso. And that was something I had not had since I had had children over 10 years ago. And it was really incredible to have that feeling, and that sparked confidence. And then when I went running, I was able to run faster than I had, having not exercised for 5 months, and not feel the back pain that came along with the hernia that I had and the abdominal separation. And so everything was really put back together. I haven't really showcased this new body that I have, but I've never been more confident. I'll get to that point where, I'm of course going to reap the benefits of the aesthetics, but just the physical control that I've had over my body is evidence enough that this was the right decision for me. And it was also just a really wonderful way for my family to pour back into Mom after all those years that I had poured into them. And it's propelled me forward in my career as well, and just the thought that it is important that I take care of myself and my own mental wellness, my physical wellness, and my spiritual wellness. And by doing something for myself, I understand and kind of see the whole picture now, to where it's okay that I take a whole day off of work and just spend time with myself. I don't only have to take time when the kids are sick, or when they have a medical appointment, and that's the only leave that I take the entire year. I'm a military spouse, so it's a lot on Mom, but I also am a professional and had a 10-year-long career in public health and do a lot with that. But I think that now I know I can make decisions more confidently at work, and I know that I need to take care of myself, and that's a gift that just keeps giving, and one that I really do credit to taking control of my body. It just really has helped me take control of many other areas in my life. So I'm very grateful and have loved my results from the surgery, and the physical, mental, and spiritual well-being overall.